10 warning signs of stroke 1 month before. A stroke is a medical emergency that requires immediate attention. While the sudden onset of symptoms is characteristic, there are risk factors and signs that individuals may want to be mindful of in their day-to-day lives. It's crucial to recognize that symptoms might not necessarily appear a month before a stroke, but being aware of potential risk factors and general signs can contribute to preventive care. Here are 10 signals your body might be sending you, providing a potential 1-month heads up before a stroke. Let's jump right in. High blood pressure. High blood pressure can act as a crucial warning sign a month before a stroke, according to recent studies. Keeping an eye on your blood pressure is like giving yourself an early alert system. To manage and control high blood pressure, try simple lifestyle changes. Start by eating more fruits, vegetables, and foods with low-fat dairy. It's like giving your heart a healthy boost. Be mindful of how much salt you eat, as too much can crank up your blood pressure. Get moving. Regular walks or easy exercises can make a big difference in keeping your blood pressure in check. Managing stress is important too, so find time to relax with activities like deep breathing or meditation. Consider saying goodbye to smoking and cutting back on alcohol. These changes might seem small, but they add up to significant benefits for your heart. Understanding high blood pressure as a potential red flag allows you to take charge of your health. By making these simple adjustments, you not only lower the risk of a stroke, but also contribute to an all-around healthier you. It's like giving your body a friendly nudge in the right direction. Sudden fatigue. Sudden fatigue can be a hint your body gives you a month before a possible stroke, and paying attention to it is crucial. Recent studies highlight the connection between extreme tiredness and the risk of strokes, making it essential to act early. To manage and control sudden fatigue, start by giving your body the rest it needs. Ensure you're getting enough sleep each night. It's like recharging your energy levels. If you feel unusually tired during the day, don't ignore it. Take short breaks and allow yourself moments to relax. Keep an eye on your stress levels. Stress can make you feel more tired and impact your overall health. Simple activities like deep breathing, meditation, or a gentle walk can help manage stress effectively. Stay hydrated and maintain a balanced diet. Sometimes, fatigue can be a sign that your body needs more water or certain nutrients. Eating a variety of fruits, vegetables, and whole grains can provide the energy your body craves. In conclusion, recognizing sudden fatigue as a potential warning sign a month before a stroke allows you to take steps to manage it. By prioritizing rest, managing stress, and maintaining a healthy lifestyle, you're not just fighting fatigue, you're safeguarding your overall well-being. Sudden, severe headaches. Sudden headaches may serve as a crucial early warning sign of an impending stroke, necessitating prompt attention. While headaches are common and often benign, the abrupt onset of a severe headache, especially if accompanied by other symptoms, can indicate potential vascular issues. In some cases, headaches preceding a stroke result from disrupted blood flow to the brain, possibly due to a blood clot or a burst blood vessel. These headaches may differ from typical migraines, often described as the worst headache of one's life. Additional warning signs can include dizziness, blurred vision, and difficulty speaking. Recognizing these symptoms promptly is vital, as early intervention can mitigate the severity of a potential stroke. If someone experiences a sudden, intense headache, along with other alarming signs, seeking immediate medical attention is paramount. Timely diagnosis and treatment can make a substantial difference in preventing long-term damage or disability associated with strokes. In conclusion, sudden headaches should not be dismissed lightly, especially when coupled with other concerning symptoms. Vigilance and swift action can be instrumental in averting the potentially devastating consequences of a stroke. Vision problems. As we age, our bodies undergo various changes. And our eyes are no exception. Recent studies suggest that vision problems could serve as early indicators of a potential stroke in the aging population. The eyes, often referred to as the windows to our overall health, may reveal subtle signs that go beyond the need for a stronger prescription. One notable connection between vision and stroke risk is the impact on blood vessels. The eyes provide a unique opportunity to observe the delicate blood vessels, and changes such as narrowing or damage may signal vascular issues that extend beyond ocular health. Conditions like hypertensive retinopathy, where elevated blood pressure damages the retina's blood vessels, have been linked to an increased risk of stroke. Furthermore, certain eye conditions such as glaucoma may be associated with an elevated risk of stroke. The intricate network of blood vessels supplying the optic nerve can be compromised, potentially mirroring vascular problems in the brain. Regular eye exams, therefore, become crucial not only for maintaining clear vision, but also for monitoring potential systemic health issues. In essence, paying attention to changes in vision can be a proactive step in identifying underlying health concerns, including an elevated risk of stroke. Timely intervention and lifestyle adjustments can play a pivotal role in reducing this risk, emphasizing the importance of comprehensive eye care as an integral component of overall health maintenance as we age. Numbness and weakness in limbs. Numbness and weakness in limbs can serve as early warning signs, indicating a potential risk of stroke in the aging population. The circulatory system plays a pivotal role in delivering oxygen and nutrients throughout the body. As we age, blood vessels may become less flexible and more susceptible to blockages, increasing the likelihood of stroke. Numbness or weakness in the limbs may signify compromised blood flow to the brain, a key precursor to stroke. These symptoms are often linked to a condition known as transient ischemic attack, TUA, often referred to as a mini-stroke. While EIAs may not cause permanent damage, they serve as crucial indicators that immediate medical attention is necessary to address underlying vascular issues. Prevention and early intervention are paramount. Adopting a heart-healthy lifestyle, including regular exercise, a balanced diet, and routine medical checkups can significantly reduce the risk of stroke. Recognizing and acting upon the early warning signs of numbness and weakness can be instrumental in preserving cognitive and physical well-being as we navigate the challenges of aging. Difficulty speaking. Noticing difficulty in speaking can serve as a crucial early warning sign of an impending stroke, prompting the need for swift attention. When faced with difficulties in speech, it's essential to take immediate action. Such challenges may include slurred speech, difficulty finding the right words, or an abrupt inability to articulate thoughts. These signs could manifest up to a month before a stroke occurs, making early awareness paramount. To address and manage this warning sign, seeking prompt medical assistance is imperative. Time is of the essence when it comes to strokes, and swift intervention can significantly improve outcomes. Healthcare professionals can conduct assessments, determine the underlying causes, and recommend appropriate courses of action. Moreover, individuals can contribute to their well-being by adopting a heart-healthy lifestyle. This includes maintaining optimal blood pressure, engaging in regular physical activity, and adopting a balanced diet. Understanding the role of difficulty in speaking as a potential alarm bell empowers individuals to prioritize their health, fostering a proactive approach to stroke prevention and overall well-being. Memory loss. Memory loss can act as a critical early warning sign, indicating potential stroke risk. Recent studies highlight the connection between memory issues and the likelihood of experiencing a stroke, emphasizing the importance of recognizing these signs. When confronted with memory loss, it becomes imperative to consider it as more than a momentary lapse. Forgetfulness, confusion, or difficulty retaining information could signal an underlying issue that may precede a stroke by up to a month. Managing this warning sign involves seeking timely medical attention. A healthcare professional can assess the severity of memory loss, conduct necessary evaluations, and determine appropriate interventions. Recognizing memory issues as potential indicators allows individuals to take proactive steps towards their health. In addition to seeking medical advice, adopting a brain-healthy lifestyle plays a pivotal role. Engaging in mentally stimulating activities, maintaining a balanced diet, and ensuring adequate sleep contribute to cognitive well-being. Understanding memory loss as a potential early sign empowers individuals to prioritize brain health, fostering a proactive approach to stroke prevention and overall cognitive resilience. Loss of balance. The loss of balance can be a significant early warning sign, potentially indicating an impending stroke. Recent studies emphasize the correlation between balance issues and the risk of a stroke, underscoring the need for heightened awareness. When confronted with a sudden loss of balance, it becomes crucial to recognize it as more than a fleeting inconvenience. Unexplained dizziness, difficulty standing, or a sudden lack of coordination may precede a stroke by up to a month. Taking swift action is paramount in managing this warning sign. Seeking immediate medical attention allows for a thorough evaluation by healthcare professionals. They can assess the severity of balance issues, identify potential causes, and recommend appropriate interventions, potentially averting the risk of a stroke. Beyond medical intervention, individuals can contribute to their well-being by adopting a proactive approach to health. Regular exercise, especially activities that enhance balance and coordination, can be beneficial. Understanding loss of balance as a potential early indicator empowers individuals to prioritize their health, fostering a proactive stance towards stroke prevention and overall physical well-being. Nausea and vomiting. Experiencing nausea and vomiting may serve as a critical early warning sign of an impending stroke, shedding light on the complex relationship between gastrointestinal symptoms and potential cardiovascular issues. Recent studies have drawn attention to the association between these symptoms and an elevated risk of stroke, underscoring the significance of recognizing such signs. When faced with unexplained nausea and vomiting, it is essential to consider these symptoms beyond routine stomach upset. These gastrointestinal disturbances may precede a stroke by up to a month, emphasizing the importance of not overlooking their potential connection to broader health issues. Managing this warning sign involves seeking prompt medical attention. Healthcare professionals can conduct thorough evaluations to understand the underlying causes of nausea and vomiting, potentially identifying and addressing stroke risk factors. In addition to medical intervention, individuals can contribute to their well-being by adopting a holistic approach to health. This includes maintaining a heart-healthy lifestyle, staying hydrated, and being mindful of overall well-being. Understanding nausea and vomiting as potential early indicators empowers individuals to prioritize their health, fostering a proactive stance towards stroke prevention and comprehensive self-care. Chest pain or angina. Chest pain, often described as a feeling of pressure, tightness, or discomfort in the chest area, can signal underlying cardiovascular issues. Angina specifically refers to chest pain or discomfort that occurs when the heart muscle doesn't receive enough oxygen-rich blood. It's a warning sign that the heart is not getting sufficient blood flow, often due to narrowed arteries. Recognizing these symptoms as potential indicators, particularly up to a month before a stroke, is crucial. Seeking immediate medical attention is paramount in managing this warning sign. Healthcare professionals can conduct comprehensive assessments, evaluating heart health and identifying potential stroke risk factors to determine the most appropriate course of action. In addition to seeking medical help, individuals can contribute to their well-being by adopting heart-healthy lifestyles. Maintaining a balanced diet, engaging in regular exercise, and managing stress are fundamental aspects of cardiovascular health. Understanding chest pain and angina as potential early indicators empowers individuals to prioritize heart health, fostering a proactive approach towards stroke prevention and overall well-being. Now that we know what the early warning signs of a stroke are, let's find out how to tell when a person is having a stroke. Acting fast is critical if you suspect that someone may be having a stroke. Immediate treatment can minimize the long-term effects of the stroke and can even help reduce a person's risk of death. FAST is an acronym that can help you quickly recognize the symptoms of a stroke. You can even download a FAST app from the webpage of the American Stroke Association to help you remember these signs. Use FAST to remember and recognize the following signs and symptoms of stroke. F. Face drooping. Ask the person to smile and see if one side is drooping. One side of the face may also be numb, and the smile may appear uneven. A. Arm weakness. Ask the person to raise both arms. Is there weakness, numbness on one side? One arm drifting downward is a sign of one-sided arm weakness. S. Speech difficulty. People having a stroke may slur their speech or have trouble speaking at all. Speech may be incomprehensible. Ask the person to repeat a simple sentence and look for any speech abnormality. T. Time to call for help. If a person shows any of the symptoms above, even if the symptoms went away, call the emergency services and get the person to a hospital immediately. We hope this information empowers you to prioritize your health and the well-being of those around you. If you have any questions, experiences, or insights to share, please feel free to comment below. Your comments can be valuable to others who may be seeking information or support. We'll see you in the next one.